A very good and warm welcome to everyone who's assembled here. I would like to invite Fayaz Alam from Anshuman on the stage for the prayer.
الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على سيد المرسلين اللهم صل على محمد وعلى آل محمد وبارك وسلم اللهم إنا نسألك الصحة والسلامة والهدى والخير اللهم إنا نسألك العفو والعافية والمعافاة اللهم إنا نسألك الخير ونعوذ بك من الشر اللهم زدنا ولا تنقصنا وأكرمنا ولا تهنا وأعطنا ولا تحرمنا وآثرنا ولا تؤثر علينا ربنا لا تؤاخذنا إن نسينا أو أخطأنا ربنا ولا تحمل علينا إصرا كما حملته على الذين من قبلنا ربنا ولا تحملنا ما لا طاقة لنا به واعف عنا واغفر لنا وارحمنا أنت مولانا فانصرنا على القوم الكافرين ہے اللہ اس ہاسپٹل میں صحت و سلامتی عطا فرمائیے خیر و برکت عطا فرمائیے ان کے ہاتھوں میں شفا عطا فرمائیے ان کے مریضوں کو شفا عطا فرمائیے ہے اللہ اس میں کامیابی عطا فرمائیے ہر قسم کا خیر عطا فرمائیے ہر قسم کے شر سے محفوظ فرمائیے ہر مہلک بیماری سے بھی شفا عطا فرمائیے اور ہمیں اسے محفوظ فرمائیے ہے اللہ یہ بیماری جو ساری دنیا میں پھیلی ہے اس سے بھی ہم سب کی حفاظت فرمائیے سارے انسانوں کی حفاظت فرمائیے اور اس بلا سے ہم سب کو محفوظ فرمائیے ہے اللہ پہلے جیسا محفوظ رکھے آنے والے دنوں میں بھی ہماری صحت کی حفاظت فرمائیے ہے اللہ صحت ایک بہت بڑی نعمت ہے اس کی قدر کرنے کی توفیق عطا فرمائے ہے اللہ جو ہمیں کھلی ہوا میں سانس لینے کی توفیق عطا فرمائے اس پر ہم آپ کا جتنا بھی شکر ادا کریں ہے اللہ اسے قبول فرمائے ربنا تقبل منا انك انت السميع العليم وتب علينا انك انت التواب الرحيم سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين آمين برحمتك يا أرحم الراحمين
I welcome you all to this wonderful event hosted by Oxymed Foundation. Since 2007, World Autism Awareness Day has been celebrated on the 2nd of April, during which we recognize the achievements and the accomplishments of people with autism. Since 2012, every year, the UN has given a theme for this celebration on the World Autism Awareness Day. So for this year, on 2021, the theme is Inclusion in the Workplace, Challenges and Opportunities in a Post-Pandemic World. So today we've gathered here to discuss and spread awareness about it. Present with us here today is the Chief of Oxymed, Dr. Ayaz Akbar, the Director of Oxymed, Mrs. Saira Parveen, our Chief Guest, Ms. Vandana Agarwal, and our guests of honor, Mr. Hussain Iqbal Shah, Ms. Raghavi Sendal, and Dr. Mohammed. Now I would like to call upon baby Nafreen, one of Anshuman's student, who is an orphan, here to present our chief guest, Ms. Vandana Agarwal, with a bouquet and a memento.
Welcome, Mr. Shankar Narayan.
Baby Nafreen will now give our guest Shankar Narayanan a bouquet and a memento.
Thanks a lot.
Baby Nafreen will now present our guest of honor, Mr. Hussein Iqbal Shah, a bouquet and a memento. Baby Nafreen will now give our guest, Ms. Raghavi Senthil, a bouquet and a memento. Baby Nafreen will now give our guest of honor, Dr. Mohammed, a bouquet and a memento. These mementos were made by Priya, who's a cerebral palsy survivor. Now I would like to heartily welcome Mrs. Sapna, who's been diagnosed with autism and is a participant of a popular singing reality show on Sun TV. I request her to sing the welcome song.
So we are going virtual from here. So Sapna will be singing to us virtually. Sapna is a child, is a young girl with autism, and she is able to sing songs. Whatever song you are giving it to her, she sings. I think Maria can just tell a little bit about Sapna.
പാട്ട് മൂടിയിട്ടുമോ okay after the song okay Sapna, as ma'am was telling, she's a young girl about 21 years old, and she was detected to have autism at a very young age, and they were trying to seek a lot of help, and they came to India, and they had to go back because the father decided that they will stay as a family, that he won't leave his daughter and the wife alone. And as a family, they have traveled so far. They had a lot of challenges. You'll be reading about a story. And as we were saying, she's a super singer, sun singer, super fame. And she has won that award, and she has recorded more than 1,000 songs. And she has got a place in the Guinness Book of National Awards. And she's trying for the World Guinness Record.
So now we have a very exciting session. Here we have the journeys and stories of our super parents. So firstly, I'd like to introduce you to Sapna's father. Sapna is an autistic child with special needs, and we would like her father to share their story with us. So that's also virtual.
We were living in Muscat. Sapna was born in Muscat. Till 2 years, she was absolutely ignored. At the age of 2, she
Hello,
was diagnosed.
I would like to share how we brought up Sapna. Since I'm doing this for the first time, like I had just noted down the points, I'm just going to read it out to you.
So we rushed to India. We went to several therapy centers. They assessed her and told the same thing. So we took a occupational therapy program for Sapna during our holidays for a month. They told us to do, along with that, skating, swimming, horse riding. This will all help Sapna to do cross-border skills. So after completion of 1 month, they advised Sapna and her wife to stay in India for treatment. But as a family, we decided we wanted to live together. We took a homemade program. We all went back to Muscat. But we bought a therapy ball, trampoline, ladder, swing, everything. We put it up in our house in Muscat. We did our own program in Muscat. At the age of 3, she went to kindergarten alone, but she found it difficult to manage. Then we went to the Indian School Management. We took a special approval to allow shadow support for these children. So great difficulty they allowed. And Sapna, along with other children, were the first batch of students in Indian School Muscat to get shadow support. So my wife, as a shadow, went to school from KG1 till 8th standard. So I'm telling in short, during these 8 years, it was a very tough journey for my wife to go to the school in the morning and be with her, write everything what the teacher teaches, come back home, teach everything, by virtue of which she learned very well. But during this time, she used to show a lot of interest in music and dance. At the age of 10, we decided that we will put her in music classes. But the teachers were reluctant to take her, she was restless. Finally, we found a good teacher named Kala teacher who took Sapna, started teaching Bharatanatyam, karate classes plus Veena. So she was learning schooling along with music in the evenings. So this was continuing till 8th standard. After 8th standard, the academic pressure was very high for my daughter as well as for my wife. So we decided as a family that let us not pursue education still further. We allow Sapna to enjoy music as a career, to pursue music. So we discontinued the schooling and we found a good teacher in Muscat, Mr. Ramesh Narayan, whom we used to come home regularly to teach karate classes. Ramesh Narayan, being a very renowned teacher in Muscat, had a lot of students. Among his best students, he used to do regular programs for karaoke, as well as in a yearly Villa program, inviting some legendary singers from India to sing along with his. During the first year, Sapna was lucky. SPB was the legendary singer who was performing in our program. Sapna was given by the teacher a special opportunity to sing along with SPB. Then her musical journey continued. She started performing in various programs, cultural programs, school programs. She won various prizes. She participated in many programs, cultural events, and other social clubs like Telugu Wing, Kannada Wing, all that. Plus, our teacher used to form another group called Nila. So she started performing with the singers like K.S. Chitra, Madhu Balakrishnan, Vijay Prakash, Ajay Warrior, Anuradha Sriram, and finally now. In the year 2019, she also got selected for Sun's Singer reality show, and she was adjudged Celebrity of the Season. She performed very well. And in 2020, we decided to come back to India to pursue our music. The moment we came back, the lockdown started, and we didn't want to keep an idle. We decided to form a WhatsApp group named Sapna 99.9 FM, where we joined around 150 group members. Based on the group members' request, Sapna will sing and record, and we used to put the recordings from every day 7:30 till 8:30. From March 30th till July 31st, she sang close to 1,085 songs where she made a record to maintain the top record for singing maximum number of songs in the WhatsApp group. Also, in September, she got an opportunity to perform in Big FM, where she had an interview along with the songs. And also she got a very special opportunity to perform in Owl Blitz YouTube channel, where she performed along with the interview. But this FM program is continuing till today, from March 30th till March 30th of 2021. We have completed 1 year, and she has sung 1,717 songs, which is a great achievement. I have briefly given you Sapna's journey from childhood till now. My wife will give more details how differently we have brought Sapna from that level to this level. She will tell separately. Thank you.
ஸ்டாப் பண்ணோம். அதுக்கப்புறம் எல்லாரும் வந்து எல்லா ட்ரீட்மெண்ட்டும் ட்ரை பண்ணோம்.
So next on line we have Aditya, who underwent his treatment for autism at Oxymed. Today we have his father who will be sharing their heartfelt story with us.
ஸ்டாப் பண்ணோம். அதுக்கப்புறம் எல்லாரும் வந்து எல்லா ட்ரீட்மெண்ட்டும் ட்ரை பண்ணோங்க. ஃபர்ஸ்ட் வந்து இந்த சப்ளிமெண்ட்ஸ்லாம் சொல்லுவாங்க. ஃபர்ஸ்ட் பிளட் டெஸ்ட், யூரின் டெஸ்ட், ஹேர் மெட்டல் டெஸ்ட் எடுத்து நமக்கு என்னென்ன இது இருக்குன்னு பார்த்தாங்க. ஹெவி மெட்டல்ஸ்னு சொல்லுவாங்க இல்லையா, மெர்க்குரி, அது போல என்னென்ன ஹெவி மெட்டல்ஸ் ஜாஸ்தியாக இருக்குது அதெல்லாம் பார்த்தாங்க. அதுல சிலதுலாம் கொஞ்சம் ஜாஸ்தியாகவே இருந்தது. அது ஸ்டிலேஷன் சொல்லுவாங்க. அது ட்ரை பண்ண லோட்டஸ் ஸ்டிலேஷன் சொல்லிட்டு ஒன்று ஆலா, ஆலா, டிஎன்டின்னு சொல்லுவாங்க. அது வந்து நம்மளுடைய ஃபாரின் டாக்டர்கள் மூலமாக வீடியோ கான்ஃபரன்ஸ்லாம் வச்சு அது ட்ரை பண்ணாங்க. அது எவ்ரி 2 hours 3 hours நம்ம வந்து செலக்ட் பண்ணிக்கலாம். ஹைட்ரோஸும் பண்ண முடியாது, ஏன்னா கவர்மெண்ட் இல்லைங்களா. லோட்டஸ் சொல்யூஷன் கொஞ்சம் ஹெல்ப் ஆச்சு. அது அந்த சொல்யூஷன் பண்ணும்போது நல்ல தூக்கம் போயிடும். அதனால அதுக்கப்புறம் நம்ம வந்து சப்ளிமெண்ட் கொடுத்து இது பண்ண வேண்டியது. என்னென்ன சப்ளிமெண்ட் இருக்கோ எல்லாமே என்னென்ன சப்ளிமெண்ட் கம்மியாக இருக்கும் அதெல்லாம் கொடுக்குறது. அடுத்தது பார்த்தீங்கன்னா ரொம்ப நேரம் சன்லைட்ல வச்சுட்டு இருந்தோம். அது ரொம்ப இதுவாச்சு. சன்லைட் மூலமா விட்டமின் டி, கால்சியம் அதெல்லாம் நல்லா டெவலப் ஆச்சுங்க. இந்த அளவுக்கு கவசம் மட்டும் போட்டு நல்லா நிறைய சன்லைட் பண்ண முடியுமோ, வெளியே வச்சுக்க முடியுமோ அது பண்ணுங்க. அதுக்கப்புறம் தெரபின்னு பார்த்தீங்கன்னா நிறைய இந்த ஸ்பீச் தெரப்பி, ஆக்குபேஷனல் தெரப்பி, நீங்க எது ட்ரை பண்ண முடியுமோ எல்லாமே ட்ரை பண்ணீங்க. ஆமா, அதெல்லாம் ஹெல்ப் பண்ணுச்சுன்னு வச்சுக்கோங்க. அப்படி பிளாஸ்டிக் சேஞ்சஸ்னா எனக்கு பார்க்க முடியாது அவ்வளோதான். அப்புறம் தான் ஆக்சிஜன்ல நாங்கள் அந்த பிரெயினுக்கு ஒரு ஆக்சிஜன் லெவல் கம்மியாக இருக்குது அப்படின்ற மாதிரி சரி ஆக்சிஜன் தெளிச்சு கொடுக்கலாம் அப்படின்னு சொல்லிட்டு நாங்கள் வந்து ஸ்டே பண்ணி அதுக்காகவே ஷிஃப்ட் பண்ணி வந்து ஸ்டே பண்ணி நாங்கள் கண்டினியூஸாக இது பண்ணேன். வீடியோஸ்க்கு நான் ரெஸ்பாண்ட் பண்ணிக்கிறேன். அது டெவலப்மெண்ட் இருந்தது. அப்படியே ஒன் டேல டெவலப்மெண்ட் இல்லை, அந்த டெவலப்மெண்ட் இருந்தது கிராஜுவலாக இருந்ததுங்க. அதெல்லாம் நாங்கள் அதில் ப்ராக்டிஸும் பண்ணிட்டு இருந்தோம். ஏன்னு சொல்லுவாங்க மசாஜ் என்ன செய்யணும் அப்படின்னு சொல்லிட்டு அதுவும் ட்ரை பண்ணுவேன். அதுலேயும் கொஞ்சம் இம்ப்ரூவ்மெண்ட் இருந்தது. இன்னும் பண்ணது குழந்தைங்களோட வெளியே வச்சு க்ளீன் பண்ண வைக்கிறது ரொம்ப ஹெல்ப்ஃபுல்லாக இருந்தது. எவ்வளோ அட்ராக்ஷன் இருக்கோ அளவுக்கு நல்ல டெவலப்மெண்ட் இருந்ததுங்க. ஆக்சுவலி நார்மல் ஸ்கூல் செகண்ட் ஸ்டாண்டர்ட் ஃபினிஷ் பண்ணி அசஸ்மெண்ட் போகிறாங்க. நம்ம பேசலாம் இன்னும் முடியாது இந்த மாதிரி டெவலப்மெண்ட் வச்சு இல்லைன்னு அவ்வளோ ஈஸியாக பண்ண முடியாது. அந்த மாதிரி டெவலப்மெண்ட் இருக்கு. இருந்தாலும் அந்த ஏஜுக்கு உண்டான பக்கம், அந்த ஏஜுக்கு உண்டான ஒரு மெச்சூரிட்டி இருக்கா அப்படின்னா இல்லை, ஒரு 1 year லேக் இருக்கு. அதில் தான் நாங்கள் ஒர்க் பண்ணிட்டு இருக்கோங்க. மற்றபடி அப்படின்னு பார்த்தா இப்போதைக்கு அவங்க எல்லாமே போயிட்டு இருக்கோங்க. சொல்லுவாங்க சொல்லுவாங்க. அதுக்கப்புறம் அதுக்கு சில டானிக் மாதிரி வச்சுக்கோங்க. அது ரெண்டும் போயிட்டு இருக்குங்க. ப்ளஸ் ஜாஸ்தி முடிஞ்ச அளவுக்கு எப்படின்னா ட்ராயிங் கிளாஸு, டான்ஸு, அவனுக்கு எது பிடிக்குதோ அதில் மியூசிக் அவனுக்கு ரொம்ப பிடிக்குங்க. கீபோர்ட் கிளாஸு எதுவுமே ஃபோர்ஸ் பண்ணாலும் எந்த அளவுக்கு அவனை இன்வால்வ் பண்ண முடியுமோ அந்த பண்ணி பண்ணிட்டு ஆமாம் அதுக்கு மாட்டாங்க. ஓகே சார், தேங்க்யூ ஸோ மச்.
So now we have Mrs. Bhargavi, Lamya's parent, who will be sharing her heartfelt journey with us.
வந்து இந்த சப்ளிமெண்ட்ஸ்லாம் சொல்லுவாங்க. ஃபர்ஸ்ட் பிளட் டெஸ்ட், யூரின் டெஸ்ட், ஹேர் மெட்டல் டெஸ்ட் எடுத்து அவங்க என்னென்ன இது இருக்குன்னு பார்க்குறாங்க. ஹெவி மெட்டல்ஸ்ன்னு சொல்லுவாங்க.
Story of Bhargavi about her daughter, Lamaya. She has global developmental delay with mild hydrocephalus and she can't walk and talk and is fully a dependent child. During her hospitalization at Child Trust, she was used literally as a research tool, as whatever possible tests we were taking, it was showing negative. She was just about 3 to 5 months at that time. In a day, they were taking blood tests and urine tests n number of times, and her feet and palm used to loom like perforated spoon. Later at one stage, they were not able to get the vein and ended up doing a small surgery behind her ears and attached 2 tubes, one to give medications and one to take blood. In spite of it, the nurses started pricking at her wrist. They even told me it's really a waste of time spending on her and asked me to leave her to die and go for another child. Today she's 11 years old. One day, a nurse injected a medicine without diluting, and Nadu, as we lovingly call her, started bloating up. It was 11 p.m. in the night, and there were no duty doctors. It was only me and my mom beside her, and was in constant contact with my dad, who is a dental surgeon. He then asked us to fight with the nurse and get the medicine removed. Also instructed us to give her warm water, and then she slowly started to come down. They took bone marrow test even without giving her a sleeping dose. And by the way, she cried, but was not bearable. For the mother, as a mother and my mom. The next day, we were asked to take kidney biopsy and also wanted me to take Ladu to Kilpaw Hospital, where all doctors will meet up and discuss about her, with her lying on the table. That's when we thought it was really, really high time we leave the hospital, and we just left. We nearly spent 3 lakhs at Child Trust Hospital. Both her kidneys were of different sizes, and after getting her treated at Mehta Hospital, it got cured. She doesn't have a separation at her vagina, no tissue formation. Thought she would do her motion through the urinary tract, but thank God she's passing it separately, but then I have to keep her really very hygienic. For this, we took her to Apollo hospitals and they asked us to do a surgery. But then a very good doctor friend of my dad at Apollo asked us not to do so as she's going to have a marital life and the tissue will grow on its own in the coming years. Keeping our fingers crossed. For the hydrocephalus, we tried doing Burma treatment and it was little effective. For the same, we went to Venkateswara Hospital at Cathedral Road, Apollo Hospitals and few other doctors for consultation. She was 3+ years at that time. They said it will cost us a lot and also they cannot guarantee if she can survive after that. So that being mild hydrocephalus, they asked us to put her on medication. Right now, she is under slump. Physiotherapy, occupational therapy, neurotherapy at a school with some exercises and lots of commands from me at home. She is improving. As she is wheelchair bound, she is completely on diapers and it costs me 1.5 lakhs per annum just for diapers and for all her medication, for seizures, hydrocephalus and some general medicine. It is costing me extra. There is a tremendous improvement now. She's trying to kneel, to sit correctly and move over for the past 1 year. She started recognizing me and sticking with me like never before. I had waited 10 long years for this. And finally, we achieved. Waiting patiently for this moment didn't go waste. All I wish is her to look into my eyes and say, Amma, Amma.
So I'd like to take this opportunity to thank all our super parents out there and also thank them for sharing their experiences with us. So here present with us today, we have Mr. Shankar Narayanan, who is a Deputy Registrar at the National Institute for Empowerment of Persons with Multiple Disabilities, also known as NIPMED. He is the father of a child with autism. So I request you to come here and share your stories with us.
With God's grace, I should not be emotional here. If I'm emotional, sometimes words may not come. So, the Almighty, please give me a strength to share my experience with you. Respected learned doctors, Chief Guest Agarwal Madam, Maria, Bhargavi, and all other my friends. How to start this? No? Please accept the reality. All the parents here, please accept the reality. लोगों का गम देखेगा तो मेरा गम भूल जाते हैं. मतलब if भगवान ने आपके पास, भगवान comes in front of you and you put your worries, all they can put your worries, you can exchange. If you give choice, I am sure you will take your worries and go. So, nothing to fear, nothing to worry. I am from southern end Rameshwaram, a Vedic family. My father is a Veda teacher. I studied Veda around 6-7 years. And by mistake or by chance, I scored good marks in my +2 or 10 something. So I was sent to Madras for pursuing my higher studies. Then I got married to a beautiful lady, my wife Vishalakshi. We are not relative. Okay? Only belongs to same Brahmin community, that's all. 1911, 98, I got a son. I named Seshadri Raghav. It's very nice. It's milestone. Everything was excellent. அந்த பிறந்த உடனே தவழறது, எழுந்து நிற்கிறது, பிடிச்சிக்கிறது, grip, everything was normal, express speech. I had a doubt. என்னப்பா அது ஸ்பீச்சில் தான் ப்ராப்ளமோ இந்த மாதிரி டவுட்டு. ஏன்னா we are not full, we are off knowledge. Everything, wherever you go, we the parents having off knowledge only because of our anxiety. ஏன்னா பிறக்கிற எல்லா குழந்தைகளும் கலெக்டராக பிறக்கிறது இல்லை, ஆர் பிரைம் மினிஸ்டர் ஒரு பிரைம் மினிஸ்டர் தான். ஓகே, பிரசிடென்ட் ஒரே பிரசிடென்ட் தான். ஸோ நம்ம குழந்தை பிரசிடென்ட் ஆகணும், பிரைம் மினிஸ்டர் ஆகணும்லாம் இருக்க முடியாது. ஸோ அப்படி பார்க்கும்போது பேசிக்கலி என் ஒய்ஃபுக்குள்ள ஆன்சைட்டி என்னென்னா, என் நல்ல பையன் படிக்கணும் வைக்கணும்னு சொன்னால் 2 வருஷத்துலேயே பேசலை. He did not speak. So we consulted a lot of doctors, homeopathy, acupuncture, எல்லா ட்ரீட்மெண்ட்டும் போய் பார்த்தோம். பார்த்துட்டு கடைசியில் ஒரு ஹோமியோபதி டாக்டர் told me that he is an autistic boy. As a proud parent, what I heard, autistic boy. He is very autistic boy. I did not know what is autism. Okay. Then I went, that time itself Google started, what is autistic boy? Then they Google whatever, many things will be there. It's very difficult to comprehend. It will divert you in different direction also. It's misguide sometime. Okay, then I come to know it is autism. Then what is PDD they are telling? Development delay they are telling. ADHD. How many terms are there? Because of my son, I learned a lot of things. Okay. Then schooling போனால் ஒரு நல்ல first class school in Navi Mumbai. I was in Mumbai for 25 years. I was associated with Atomic Energy. Fantastic school, Father Agnel School. Admission கொடுத்தாங்க. அது Rodriguez is my close friend, அந்த man. அட்மிஷன்லாம் கொடுத்தாச்சுன்னா அவன் பையன் பேச மாட்டேங்கிறான்டா. சார் பேச மாட்டேங்க, நான் என்ன சார் பண்ணுறது? இல்லை, we cannot help. அப்போ இன்க்ளூசிவ்லாம் அந்த அளவுக்கு பேசப்படலை. Inclusive education, அதெல்லாம் nothing was there. In Bombay, I am telling you, not Madras, it's the finest city, I am telling you. There it was 2000. They have never talked about inclusive education. Okay? Then போயாச்சு. தென் அங்கேருந்து அனுப்பிச்சிட்டாங்க. ஃபாதர் அக்லன் பையன் ஐ டு ஐ கான்டாக்ட் கூட இல்லை, என்ன பண்ணுறது? ஸோ அங்கேருந்து மாண்டிசரி ஸ்கூலுக்கு போனோம். அங்கே போனால் அந்த பையன் மற்றவங்களோட பியர் குரூப்பில் ஹீ இஸ் நாட் மிங்லிங் வித் பியர் குரூப். ஓகே, தென் வாட் ஹஸ் ஹேப்பன்? ஸ்பெஷல் ஸ்கூல் போகலாம். ஸ்பெஷல் ஸ்கூல்னால் அது ஒரு பெரிய இது. ஒரு ஸ்பெஷல் ஸ்கூலில் ஒரு மாதிரி சொல்லிக் கொடுப்பாங்க, இன்னொரு ஸ்பெஷல் ஸ்கூலில் சொல்லுவாங்க அவங்க காக்னிட்டிவ் சரியில்லைப்பா, இவனுக்கு மோட்டர் ஃபங்க்ஷன் சரியில்லை, அது இது நம்மளுக்கு ஒன்றுமே தெரியாது. அஸ் அ பேரண்ட் வி ஆர் இன்னோசென்ட், வி டோன்ட் நோ எனி திங். ஃபைன் மோட்டர்னால் இப்போ தான் தெரியும், ஃபைன் மோட்டார் ஃபங்க்ஷன்னா என்னன்னு தெரியும். அது வரைக்கும் ஃபைன் மோட்டார், டு பி ஃப்ராங்க், ஐ டிட் நாட் நோ வாட் இஸ் ஃபைன் மோட்டார் ஃபங்க்ஷன். Again, I give sincere thanks to my son to learn a lot of things because he is ASD. Then இஸ் non-verbal going அப்படியே போகும்போது அவன் அகடமிக் பர்சியூட் வந்து போயாச்சு. ஸோ ஹியர் ஐ வாண்ட் டு ஷேர் ஒன் திங். I request all of you, there is 3 types. One is mild, another is moderate, another is severe. Okay? Accept the reality. Severe is severe only. நீங்கள் ஒன்றும் பண்ண முடியாதுலாம் சொல்ல வரல. You have to live with that. For example, first video they showed, his father brought to India, then went back. It's a family. If you live with family, my wife she's got operated some brain surgery. My wife still, she is telling today when I leaving from my home, she was telling, why not to take some biryani to my son and give. He is in the hostel. My wife is still thinking about Sheshu should with us because I have undergone bypass. My wife recently she undergone neurosurgery. So at this stage it's very difficult to keep my son with me. Try to understand. He is a severe non-verbal autistic boy. Please accept the reality. This is the reality. We have to run the show. Okay? So this is my story. Another is not advice. This is a request to all of parents and whoever concerned. We cannot blame anybody. People will think that last Janma I would have done some sin. That is why there is no vouch for that. It's only belief. Today is permanent. Tomorrow also we don't know. Next minute we may not know. So at this situation, I strongly believe that we have to learn to live in the present. This evening, this moment, if I make any one of you to happy, that is sufficient. Why not we think? Live in present. Another piece of, don't take his advice. This is a suggestion. You have to learn from past. Something happened in the past that we should not repeat. At least. I can share, I don't know. Some people think that they are intelligent. They came and asked me, why not to go for second child? Why you have done a mistake? You have to take second child. I told him only one justification. Many people may not agree, but it is true. What is that? When I got married, we both, my wife and myself, had a confidence that we will have a normal child. Now we have one autistic boy. Please tell me whether I can go for second child. My confidence level will increase or decrease. A kind of responsibility also towards society. I have to grow my child. Okay? And at this, see in Bombay city, logistic will be a big issue. So occupational therapy will be sitting in some 8-9 kilometers to go to that. Now at this level I can afford for taxi or something. In 2000, I was in a position I cannot afford a taxi. I had to go by public transport. It's not easy in city like Mumbai. So these are all things is there. I don't have any intention to discourage you. I am here to suggest, not even advise. I am not here to advise also. Okay, so the thing, I hope my story is not, I am very smiling face. You know why? I don't have any anxiety. Another piece of suggestion I am giving you, please expect little. That is the only thing you can do. You don't expect too much. Second thing is very much, is rich. I am not rich. That also, comparison also will give you lot of. I request, if you want to sleep well tonight, from tonight onwards, You want to sleep? No. Expect a little. Don't expect too much. Suppose somebody is coming. Okay. You will do wonder. ऐसा कोई नहीं है. You may do damages also. You must be ready for everything. Okay. Then I will come to my my profession. I'm telling you. There is a central government, state government. Okay. I belongs to a national institute. That national institute, this particular national institute responsible for 4 major disabilities. One is cerebral palsy, another is deafblind, third is autism spectrum disorder, fourth is multiple disabilities. This is the Asia's biggest institute in Asia, right? We are not only dealing, any people with disability can approach us first. There are a lot of schemes in India, particularly central government and state government, they are doing, especially I am telling you in India, Tamil Nadu only is doing fantastic job towards people with disability. I have come across, I have gone. Yeah. No, I'm telling the reason I'm telling you, people like you and me only should work and initiate that. And nobody else will do that. People like me should go and advise them. And central government, state government cannot do anything. If you have any grievances, please come. I will also come. We will meet the appropriate authority and do that. And here, we are not here to blame. I already told you. We are not here to blame. We have to make it happen. That should be our motto. Otherwise, we will be sitting, sir, that those government is not doing this government. Empty number of schemes are there, empty number of any help, please contact me. Suppose any issue is there, I never utter the word problem. There is no problem in the word. Only issues are there. Those issues can be solved easily if you have a proper setup, proper perspective, proper approach. Definitely we can do wonders. 90% people are very good towards people with disability. Only 10% of people are not happy with people with disability. Maybe some other story, even after marriage, one autism boy or something, you will go. So, with that note, I have very limited time. I don't want to take too much of time. I am a talkative person, so I am. Luckily, I am not so much emotional. I could share something, and I request you once again, please, in case of any assistance regarding the benefits, even reservation, even education, treatment, rehabilitation, please approach me. One thing. Second thing, I am very, very happy. There is a gap between the medical field and rehabilitation field. I request these two fields should be complementary. I sincerely believe once when one particular stage, doctors will say, go, you can't do anything. Another stage, this rehabilitation people will fight with doctor. So that kind of thing should not be done. I'm very, very happy this medical foundations having this kind of approach. Definitely a kind of multidisciplinary approach and transdisciplinary approach will definitely fetch good result, and it will light in the life of people with disability. Thanks for opportunity. I hope we will meet again. Thank you.
Thank you very much, sir. That was indeed very enlightening for us, because when we are there on the other side, we don't get to know. But when you are here this side, we get to know a lot. Thank you, sir. Now I would like to invite two great moms, both of them having a child with autism. I would like to invite Anandi. Anandi's son's name is Rishikesh. She works at Balavihar, and Vanga. Give her a big clap, because it takes a lot of courage for parents to come out.
எல்லாருக்கும் வணக்கம். என் பேர் ஆனந்தி. நான் வில்லிவாக்கத்துலேருந்து வரேன். எனக்கு 2 பெண் குழந்தைங்க இருக்காங்க. இவன் வந்து எங்கள் மச்சின குழந்த. இவன் இந்த மாதிரி இருக்கான்றதுனால 3 வயசுலேயே அவங்க 2 பேருமே விட்டுட்டு அவங்கவுங்க லைஃப்பை பார்த்துட்டு போயிட்டாங்க. எங்கள் சொந்தக்காரங்க யாருமே இவனை எடுத்துக்கல. அதனால் நான் எங்கள் பசங்கக்கிட்ட எங்கள் குழந்தைங்களாம் அப்போ சின்ன பசங்களாக இருந்தாங்க. அதனால் நான் எடுத்துக்கிட்டேன் இவனை எடுத்துக்கிட்டு இவனுக்கு 12 வயசாகுது. இவனால் எனக்கு நிறைய பிரச்சனைங்க எங்கள் குடும்பத்தில் வந்தது. எங்கள் வீட்லேயே எங்கள் அம்மா வீட்லேயே என்னை யாருமே வந்து எதுக்கு இந்த பையனை நீ வளர்க்குற, இவனால் உனக்கு என்ன பிரயோஜனம், இவன் வளர்த்து உனக்கு என்ன செய்ய போகிறான் அப்படின்ட்டு என்னை தினமாக சொல்லிகிட்டே இருப்பாங்க. நான் எங்கேயும் ஃபங்க்ஷனுக்கு கூட எங்கேயுமே போக முடியாது. எங்கள் வீட்டு ஃபங்க்ஷனுக்கெலாம் போனாலே என்னை வந்து இந்த பிரச்சனையை பற்றியே பேசுவாங்க. எங்கள் பசங்கக்கிட்டேயும் எங்கள் 2 பொண்ணுங்க இருக்காங்க, அவளுங்கக்கிட்டேயும் எல்லாருமே வந்து இந்த பையனை எதுக்கு உங்கள் அம்மா வளர்க்குறாங்க, இவனால் என்ன இருக்குது பிரயோஜனம், அமுச்சு விட சொல்லு, உங்கள் அம்மாவை எங்கன்னா ஹாஸ்டலில் சேர்த்துட சொல்லு அப்படின்ட்டு எங்கள் பசங்கக்கிட்ட நான் தினமும் உட்காந்தும்மா தப்புமா, அதெல்லாம் அவங்க சொல்கிறதுல நீங்கள் கேட்கக்கூடாது, இவனை நம்ம வளர்த்தோன்னா நீங்கள் நல்லா இருப்பீங்க சந்தியா தீபா, அதெல்லாம் தப்பு, இது கடவுள் குழந்தை, இது அவங்க சொல்கிறதுல நீங்கள் கேட்காதீங்க, நான் அதெல்லாம் விட்டுருங்கம்மா, இவன் நம்ம தம்பி, நான் அம்மாவுக்கு பிறந்தான்னு நினச்சிக்கங்கம்மா நீங்கள் அப்படின்னு நினச்சிட்டு அவனை நம்ம வளர்க்கலாமா, அவனுக்கு கடவுள் நம்மளுக்கு கொடுத்த பெரிய கிஃப்ட்டுமா இவன், அதனால் அந்த மாதிரிலாம் செய்யக்கூடாதுமா அப்படின்ட்டு இப்போ ஸ்கூலில் சேர்த்துருக்கேன். ஏன்னா நான் வேலைக்கு போகிறேன், நான் பெருக்கிற வேலை செய்கிறேன் பாலவிகார் ஸ்கூலில், அதனால் பார்த்துக்க யாருமே இல்லைன்றதுனால இப்போ தான் ஒரு 2 மாதமாக ஸ்கூலில் அவனை சேர்த்துருக்கேன். இதை என்னால் முடிஞ்ச வரைக்கும் அவனை ஃபீஸ் கட்டி படிக்க வச்சிட்ருக்கேன். என்னை இந்த வாய்ப்பு கொடுத்துக்கிறதுக்கு எனக்கு கொடான கோடி நன்றி.
Next, I would like to call Divya. Come. Divya, வாங்க உங்கள் பையனை இன்ட்ரடியூஸ் பண்ணிக்கோங்க, வாங்க. And by the way, she is also done a special education course for the sake of her son. And she is working at Balavihar.
எல்லாருக்கும் குட் ஈவினிங் டு ஆல். என் பேர் திவ்யா, நான் முகப்பேர்லேருந்து வரேன். ஃபஸ்ட்டு குழந்த வந்து பிறந்தோடனே ரொம்ப அழகாக இருந்தான், பார்க்குறதுக்கு ரொம்ப க்யூட்டாக இருப்பாங்க. ரொம்ப திடீர்னு துரு இந்த 1 வயசில் வந்து ஸ்பீச் வந்து லேசாக நிற்க ஆரம்பிச்சிருச்சு. அதிகமாக அட்வர்டைஸ்மெண்ட் பார்ப்பான், படிக்கட்டு 100 வாட்டி ஏறி இறங்குவான். சரி குழந்த ரொம்ப ஆக்டிவாக இருக்கான்னு நினச்சி நாங்கள் ரொம்ப சந்தோஷப்பட்டோம். சரின்னு சொல்லிட்டு அப்புறம் பார்த்தா இது ரொம்ப பார்த்துக்கவே முடியாத சூழ்நிலை ஆயிடுச்சு. வீட்டில் எதனால் பிரச்சனை வர ஆரம்பிச்சு, நீ அவனை கவனிக்கல, இஷ்டத்துக்கு விடுற அப்படின்னு சொல்லிட்டு இருந்தாங்க. அதுக்கப்புறம் நாங்கள் என்ன பண்ணோம், சைல்டு ட்ரஸ்ட் ஹாஸ்பிட்டல் போனோம். அங்கே போயிட்டு ஒரு கன்சல்ட்டிங் ஒரு டாக்டர்கிட்ட போனோம். அவர் ஜஸ்ட்டு அவனை ஒன்றுமே பார்க்கல, சும்மா கூப்பிட்டாரு பேர் சொல்லி. உடனே ஆர்டிஸ்டிக் ப்ராப்ளம்னு சொல்லிட்டார். அந்த வார்த்தையே எனக்கு புரியல, அதை பற்றி எனக்கு தெரிஞ்சதும் இல்லை, என் ஃபேமிலியிலே யாரும் நான் என்னோடய வயசு வரைக்கும் நான் பார்த்தது கிடையாது. அதுக்கப்புறம் சரின்னு சொல்லிட்டு என்ன பிரச்சனைன்னு சொல்லிட்டு நாங்கள் நிறைய ஹாஸ்பிட்டல் போனோம். இது ஒரு ஆட்டிசம் டிசார்டர், பெர்வசிவ் டெவலப்மெண்டல் டிசார்டர்னு சொன்னாங்க. எனக்கு ஒன்றுமே புரியல. சரி இது என்ன, இது ஒரு பிரச்சனை தான் பொழுக்கு, சும்மா மாத்திரை மருந்து குத்தா சரியாயிடும்னு நினச்சேன் ஆரம்பத்தில். ஆனால் இது ஒரு தீர்க்க முடியாத பிரச்சனைன்னு சொல்கிறாங்க. ஆனால் இது தீர்க்க முடியும் நான் நினைக்கிறேன், ஏன்னா அது நம்ம கையில் தான் இருக்குதுன்னு நான் நினைக்கிறேன். அதுக்கப்புறம் நான் ரொம்ப மனசு கஷ்டமாயிடுச்சு. வீட்லேயும் வந்து வெளியே போக மாட்டேன், ஒரு நம்மளுக்குள்ளே ஒரு மனநிலை பாதிக்கப்பட்ட மாதிரி ஆயிடுச்சு. வெளியே போனால் பிரச்சனை, எங்கே போட்டாலும் துருன்னு இருக்கான் அவங்க பையன் அப்படின்னு சொல்கிறது. வெளியே இப்போ யாருக்குன்னா ஒரு பார்க் கூப்பிட்டு போனால் அவனை எல்லாரும் ஒரு மாதிரியாக பார்க்குறது. இப்போ நம்மக்கிட்டேயே வந்து கேட்பாங்க, ஏன் உங்கள் பையன் மட்டும் இப்படி பண்ணுறான் அப்படின்னு கேட்பாங்க. அப்படிலாம் ஒன்றும் இல்லைன்னு நான் தைரியமாக தான் இருப்பேன் எல்லா விஷயத்துலையுமே. அதுக்கப்புறம் நானும் எங்கள் ஹஸ்பண்ட் நிறைய பார்க் கூப்பிட்டு போகிறது, வெளியே கூப்பிட்டு போகிறது, இந்த மாதிரி நிறைய பண்ணிகிட்டு இருந்தோம். அதுக்கப்புறம் எங்கள் ஹஸ்பண்ட் சொன்னார், நீ இந்த ஸ்பெஷல் எஜுகேஷன் படி அப்படின்னு சொல்லிட்டு நான் ஸ்பெஷல் பிஎட் பண்ணேன். 2 இயர்ஸ் கோர்ஸ் பண்ணி இப்போ ஒரு 7 இயர்ஸாக இந்த ஃபீல்டில் இருக்கேன். இப்போ பாலவிகார் ஸ்பெஷல் ஸ்கூல் தான் போயிட்டுருக்காரு. இப்போ குவாரண்டைனால் வீட்டில் இருக்கிறாரு, தெரப்பிலாம் போயிட்டு தான் இருக்கிறாரு. இருந்தாலும் தினமும் ஒரு பிரச்சனை தான், தினமும் ஒரு போராட்டமான வாழ்க்கை தான். இருந்தாலும் இதுவும் ஒரு வகையான சந்தோஷமாக தான் இருக்குது. தேங்க்யூ.
ரொம்ப நன்றி ஆனந்தி அண்ட் திவ்யா. அருமையாக வந்து உங்களுடைய பயணம் ரொம்ப சுருக்கமாக இருந்தாலும் பட் நாங்கள் வந்து நியூஸ் லெட்டரில் உங்களுடைய ஸ்டோரியை கண்டிப்பாக ஆட் பண்ணுவோம். Now I invite Jayanti Mani, who is a parent and a special educator. Her son is Arya. She's come with the husband, Mr. Anand, and I welcome all of them. And Jayanti, please. She's my student, by the way. I'm very proud to say that she's my student of special education.
This is Arya. Say hi. Hi. You want to go sit there? Sit. Hi, everyone. Very inspiring to see another two moms, and that too, they are sharing a different story. It's autism is, you don't know what, till now, till date, every single second is different, and we are ready for that. That is what it is. My journey was like myself and my husband, and I have one more child who's neurotypical. So we all had a very good lifestyle in Dubai, and we had normal, so-called normal lifestyle. So he's the second child for me. So I couldn't find any difference because all kids are active, all kids are delayed in speech because of too much exposure of TV and all those stuff. So I was a reluctant parent. When everybody said that he's not speaking 2 years, still you are not knowing, he's very stubborn. I was not, because I have another child he was also the same, he was stubborn and all those stuff, so I was arguing with him. So once when I put him in a school, the principal called me and said, that day I will never forget, she was directly speaking to my husband only because she knows that I will not accept. So she said, when I call him Maria, he's not turning back. And he's not going towards the children at all. He's all alone on himself, which I never knew, though he was 5 years old. When a third person is saying, you're not able to accept it. I'm an educated person. I have been in a very sophisticated lifestyle. Still, how can that principal say to me? But now, I thank that principal wholeheartedly. Early itself, she told me in a perfect way, which was rude, but still, she told me. Then I came back to India. That situation, I didn't know what to do. I came back with both my children here. Though I am a Chennai Vasi, I have been here, but still after marriage, I myself with my two children, we were alone because too many people says, too many advice every day. ஒருத்தங்க வந்து போய் கோயில் கும்பிடுன்னுவாங்க, ஒருத்தங்க வந்து don't ask me, like everybody likes me. That's the main reason. They likes me, that's why they come and see it and take, but they don't know what idea they're saying. So for me, my parents were there, my grandparents, lovely parents, but still, I was very stubborn. I said, I'll be living alone with my kids. My husband was completely supportive to me financially. So I could take him from, to be frank, he was 5 years. Almost all 5 days I used to go to OT. I used to go to any corner where there is special kids, I'll go. But I didn't know, I thought if I send him to a therapy, that miracle will happen, he will be normal. That is what I was thinking. Though I was an educated person, still, I was sitting outside and was praying, something is happening inside. Within 2 years, I'll be back to my husband. That was my inclusion. Then slowly I was seeing all the parents rounding again the small world. ஒரு தெரப்பி சென்டர் தேய்ச்சி இன்னொரு தெரப்பி சென்டர் போனால் அங்கே உட்காந்துருப்பாங்க. என்னடா அவங்க இங்கேயும் வராங்க அங்கேயும் வராங்க, இங்கேயும் 5 வருஷம் பண்ணியிருக்காங்க, அப்போ நானும் 5 வருஷம் பண்ணணுமா? எனக்கு புரியவே இல்லை. Though the professionals know that this is a condition, it is not a disease, it will not be cured, but they'll not say to you. They'll just say, we will take care, that's all. So though an educated person like me, நானே ஒன்றும் பண்ண முடியலன்னா இவங்கெல்லாம், I'm saying, இவ்வளோ early-ல நீங்கள் இவ்வளோ யோசிச்சு பண்ணியிருக்கீங்கன்னா, applaud to you. Because if it's going to be your son, if it's going to be a child, there is so much emotional imbalance with us. We are not able to accept it. We are not able to judge it. We are so confused. But அந்த கன்ஃபியூஷன்லையும் இவ்வளோ ஸ்ட்ராங்காக அந்த 2 லேடிஸ் பண்ணியிருக்காங்கன்னா, I'm so happy. I made it today. I came here. Thank you to Maria ma'am actually. Because இன்னைக்கு வந்து autism, என் பையன் autistic child அப்படின்னு நான் தைரியமாக சொல்கிறேன். Because அப்போ வந்து அது சொல்லக்கூடாது, ஸ்பெஷலுங்கிற வார்த்தையை சொல்லவே மாட்டோம் நாங்கள்லாம். ஸ்பெஷல் இஸ் சம்திங் வெரி குட். ஒரு ஸ்பெஷல், ஒரு ரெஸ்டாரண்ட் போனோம் அப்படின்னா ஸ்பெஷல் தோசை கேட்கணும்னு நினைப்போம், ஸ்பெஷலாக ட்ரெஸ் பண்ணிக்கணும்னு நினைப்போம். ஆனால் உங்கள் சைல்டு ஸ்பெஷல்னா மட்டும் ஒத்துக்கவே மாட்டோம். ஆனால் நான் சொல்கிறேன், என் பையன் ஸ்பெஷல்ன்றதால நான் நிறைய கற்றுக்கிட்டேன். I have learned a lot which I have never learned through education, through people. I have learned to accept everyone the way they are. I can accept any person. Oh, இவங்க இப்படியா, okay. அவங்க எப்படி இருக்காங்கன்னா அவங்க situation அதனால அப்படி இருக்கு. So there are so many things which I can't say through words that he is teaching me every day, and I'm so blessed that I got him. So அதனால whenever I see younger parents, I just want to show off that I can dress up myself. That's again Maria ma'am's inspiration, because when I went for a special education, I wanted to know, சும்மா வெளியில உட்காந்துட்டு மற்ற பேரண்ட்ஸ் மாதிரி உள்ள தெரபிஸ்ட் பண்ணுவாங்க எல்லாம் சரியா போயிடும் அப்படின்னு உட்கார முடியல என்னால். I want to teach parents, நீங்களும் பண்ணும், தெரபிஸ்ட் பண்ணுவாங்க, பட் யூ ஷுட் ஆல்சோ ஃபாலோ அப் அண்ட் டூ இட். அப்போ தான் உங்கள் குழந்தை எப்படின்னு உங்களுக்கு தெரியும். தெரபிஸ்ட் கிட்ட அழகாக அந்த பீடை கொத்துருவான், என்கிட்ட கொண்டு தான் தூக்கி அப்படியே பறக்கும் எல்லாம். என்னடா நடக்குது, எவ்வளோ வருஷம் நம்ம இப்படியே இருப்போம் அப்படின்னு I was thinking. But soon I went to a special education course. That too, it was just one Sunday, which I don't know where I leave my child. He was with my driver who's taking him to swimming pool and all those stuff, occupying. That whole day is precious to me because my child is with somebody else. But still I need to learn. It is not for me only. I want to learn and say to other parents. மற்ற பேரண்ட்ஸ்க்கு நம்ம காமிச்சே ஆகணும், நம்மளால் நிச்சயமாக இந்த குழந்தைங்களை வச்சு சக்ஸஸ்ஃபுல்லாக வாழ முடியும், சந்தோஷமாக வாழ முடியும், எல்லார போலையும் வாழ முடியுங்கிறது எனக்கு நான் காமிக்கணுங்கிறதுக்கு Maria ma'am was the inspiration. Because first day when I saw her and Priya, I said, no, I will be like Maria ma'am one day. I was like, because she'll dress up so very well. எல்லா பேரண்ட்ஸும் பார்த்தா ஒரு சோகமாகவே இருப்பாங்க. இப்போ பாரு, they'll be saying, என்ன பண்ண போகிறோம் மேடம், அடுத்த மாதம் வருஷம் அவனுக்கு வயசாயிடுச்சு, அடுத்த பர்த்டே வந்துச்சுன்னா நான் என்ன பண்ண போகிறேன், பெருசாயிட்டான். ஒரு பர்த்டேவை கூட சந்தோஷமாக அவங்களால கொண்டு விட முடியாது, ஏன்னா நெக்ஸ்ட் இயர் எப்படி இருப்பானோ அப்படின்னு ஒரு பயம் இருக்கும். பட் she'll come in an auto with fully dressed with all smiles. நான் பார்த்து நினச்சேன், மரியா மேம் மாதிரி தான் இருக்கணும் நம்ம. அப்போ I should be near her more to see how she survives her life. So true inspiration is her, and from her only I have spoken to many people. Now I am a parent counselor. I have done my MSc psychology. I have done my special ed with Maria ma'am's guidance. So wherever I go, I see all my kids are my kids. All the parents are my sisters. So whatever I could do for them, I am there. When I am there in one area, I have put a WhatsApp group. Wherever I go, wherever I see moms, I just put them in my, whatever you want, I'll just direct the professionals, because without professionals, you can't survive. Professionals has to be there. So thank you for this opportunity. I'm really happy to be here. Autism is a wonderful feeling only if you accept it. Accept பண்ணல அப்படின்னா 20 வயசுல கூட நிறைய பேரண்ட்ஸ் இன்னும் அக்செப்ட் பண்ண மாட்டாங்க. அக்செப்ட் பண்ணுங்க, குழந்தைங்க சூப்பராக வராங்க. நிச்சயமாக அவங்க இண்டிபெண்ட் லைஃப் பண்ண முடியும் இஃப் யூ அக்செப்ட் தெம். தேங்க்யூ ஃபார் த ஆப்பர்ச்சுனிட்டி. தேங்க்யூ.
Thank you all the super moms for sharing your experiences with us. So now I take pride in welcoming the Chief of Oxymed, Dr. Ayaz Akbar. I humbly request you to address the gathering and share a few words about autism at Oxymed.
Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. Good day. Indeed. Distinguish our chief guest, Vandana Agrawal, director of VVA and VVT group of companies, which owns the Radisson group of hotels. Our guest of honor, Mr. Hussain Iqbal Shah, Mr. Shankar Narayan, Dr. Muhammad, neurosurgeon, former HOD of King Abdul Aziz, Saudi Arabia. Now he's a director of Oxymed Hospital, Neurological Department. And Ms. K. Raghavi Senthil Kumar, Dr. Maria Fatima, and our medical director, Dr. Ramanathan Muttaya, and Mrs. A. Saira Parveen, director of Oxymed Hospital's Research Institute and Foundation. Indeed, it's a great joy for me to join in this World Autism Day Awareness Program, which is held on 2nd of April throughout the world. I'm highly pleased for the dignitaries for having accepted the invitation and come over here all the way to give an encouragement and support to the parents and then the suffering children. Thank you, ma'am. Thank you. Well, all are learned with several experiences about autism. I don't want to dwell upon on that subject as I am being the preventive cardiologist. But what Oxymed is contribution in the field of autism? See, basically, you all have heard the most common therapies on the table is OT, BT, ST, and PT. That is occupational therapy, behavior therapy, speech therapy, and physiotherapy, of course. Along with this, diet also plays an important role because certain food, children are intolerant to certain types of food. They have to work closely with dietitians, and then they cannot be having anxiety. They have to give it a pretty long period, which food is working, which food is not working. This is also plays an important role. But I don't like to take much of time because my wife said I have to finish within 5 minutes. I'll make it a point to finish in 4.5 minutes. We at Oxymed, we are associated with ACAM, American College of Advanced Medicine, where in US, they are using a protocol called chelating agents. These autistic children, some of them, they are with metal and metal toxicity. There is a component called EDTA, ethynyl diamine tetraacetic acid. Along with this conventional therapy, IV intravenous we give, where the metal toxicity is being eliminated. Now, to make it simple, earlier days we were all using lead pipes. It used to corrode. And as we all have evolved, we have all transformed to PVC pipes. Likewise, when the blood circulation is good, basically a lot of oxygenation and a good development. Apart from that, there is also called hyperbaric oxygen therapy. For a pretty long time, our country did not know about this. In US, it's quite popular. When I say what is hyperbaric oxygen, it's a huge chamber. It's a pressurized air. It's like a submarine. We all are living in an atmospheric pressure of 1 ATA with 21% of oxygen. So today, if you see in any field, any type of diseases, first blindfold, the moment we give is 100% oxygen as support. Because without food, without air, without food, without water, without medicine, you can live for some time. But without proper oxygen, you cannot survive more than 3 minutes. You would have come across, there are certain children who are 13 years, 14 years, but still they'll be behaving something like 3 years, they say, underdeveloped brain. We call it hypoxic condition. So the blood does not reach to the brain. So the hyperbaric oxygen, our country has tried. There are two types of chambers. One is a monoplace, which is inexpensive. It can be used at home, but autistic children cannot go. It's a monoplace. They require a support, their parents, somebody. So unfortunately, it is so expensive, such a big chamber. It's like a big aircraft. Only few chambers are available in India. In North, about 1 or 2. And in Bombay, I know in Godrej Memorial Trust, they have a chamber. Similar chamber, it's the only one chamber. We at Oxymed Hospital Research Foundation, we have this. And to maintain that, every part has to come from US. In 2014, we spent almost about 14 crores to bring this technology. And we are making it as much possible as economical for the deserving people to take this treatment. To our surprise, most of our patients have come from US, from Australia, from UK, because it's very expensive. These NRI people, they used to come during the, especially during the Christmas times, and have benefited. So, our director, Saira Parveen, she's a social worker. She has floated an institution called Anchor, where they give free loans. Here at Oxymed, she has made as a charitable foundation where she collects funds, and those who cannot afford, even we come across sometimes the expensive ICU medicines. So from there she contributes, and then we are able, because it is very difficult for any suffering patient to say, go to the government hospital. They chose you because they wanted the best. And we are trying our best as much as possible to give our support. And we are all the time, we are learning. We are associated with the various bodies in US, and we hope we'll continue to learn and serve our best to the society. Thank you for your patient listening.
Thank you so much, sir, for sharing your knowledgeable words with us. It is my pleasure to introduce our guest of honor, Mr. Hussein Iqbal Shah, who is the Assistant Secretary and Co-Chairman at Darul Ansar Center for Applied Learning. I request you to share a few words with us.
Assalamu alaikum wa rahmatullahi wa barakatuh. And let me greet all of you. I have greeted with the Islamic greetings. And now a very good evening to one and all assembled here. And I really appreciate the parents who have come forward. In fact, these kind of parents are very much needed, is the need of the hour. To get rid of, I won't say to get rid of, but to make other parents understand their responsibility. Well, I'm also a social worker along with Saira Parveen, who's the director of this hospital. Now for a very long time, for over almost 2 decades. So in Anjuman, let me first say, though today is the Autism Day, it is always unique, totally, sometimes mysterious, is autism. Okay. Now, I came with a lot of papers that I will speak on this thing, but after hearing each parent, everything, I'm just going to put this aside. And I'm going to tell you the kind of, both of us come from a charitable institution which is 135 years old, which has orphan children, both boys and girls, from different, the lowest ebb of the society, of the Muslim society. We have only Muslim children. As days had come, we wanted to excel in education. So we started a school way back in 1998 in the Anjuman campus, known as the Anjuman Matriculation and Higher Secondary School. That grew up and things like that. And as this school grew up and we started taking children from outside of various other religions and irrespective of caste, creed, religion, everything. Then we saw certain behaviors of the children in the hostel. At that time, the founder, chairman of this Darul Ansar Center for Applied Learning, which is a part of Anjuman Islam unit, we found that a lot of parents, a lot of children were behavioral issues and everything. And it became a really issue in the campus that these children were not being this thing. The easiest way out was, used to say, send them away home. Little did we realize that we are going to send this child out into this world. Here we are, when he's till his teens, everything, we have looked after him with all facilities, kept him inside, all that, everything we have done. And one fine day, because the teacher says, the warden says, no, he's no good. He has to leave, the other children are getting affected. That is the time that one of the student of the same very Anjuman, who was sent out of the school and came back and said, no, I want to meet, the person I'm referring is the chairman of DECAL, Dr. Salahuddin. He came up to him. Fortunately, I was also there. This boy comes up and tells, thank you, sir, for having sent me out of the school. It was a shock. Really shocked that you have sent me out of the school. Why, what happened? I mean, he could not trace what was this thing. Then we called out for papers and everything, found out. Having sent me out, somebody else saw my deficiency in my education. And they imparted education for me. And then I have come to this level, and he works for the Merchant Navy now, that boy. And he handed over a check to the very same Dr. Salahuddin. Okay, that is one incident. Now coming back, this incident, after this incident, he was very much disturbed, and he said, no, we have to do something. No child is going to leave this campus without education. And that is the rule even today in Anjuman. No child will be sent out, because as these children come from a very low background, and if he is going to go, I do not want to mention, I have had one fellow, and it's very unfortunate that boy is still serving. He's in the prison for the last, he's been made for 14 years. I'm trying out all my best to see that he's been sent at least by this Independence Day. That is how I'm working separately on that child. Okay, a child with no this thing, just sent out and things like that and become like that. Though I have trained that boy in ITI and everything, wrong company and things like that. So education at the initial level is very, very important. And a community which I come from, rather all of us here, most of us, is a community which has been really tainted with all sorts of things. Okay, worldwide, not only. I've traveled around the place on official work and personal this thing also. So that we wanted to eradicate. That's how we started this unit called Darul Ansar Center for Applied Learning. And when we started with 20 children of the same hostel, both boys and girls. And out of this 20 boys, I told they were with certain dyslexics. We were able to overcome that and everything. Today, some of them are graduates, some of them are working in various fields. And in fact, one boy is also an engineer. That is apart from. But later on, we felt that this has to grow. And when we found, because we have a system in Anjuman, that when we take students, it is not the word of mouth by anybody. We go personally, each member of us. And that topper is Mrs. Saira Parveen. Okay. She will travel up to Andhra Pradesh and come back. Okay. Yeah? So that is how we see the standards, I mean, their living style and everything, and bring those children to our home. I'd like to share a boy who's today working in ESI hospital as a doctor. One girl is in Gujarat who is a doctor. All these children who have come as orphans or destitute from families or poor families. So that is what we do here. I mean, in Anjuman does this. That apart, after starting this Darul Ansar Center for Applied Learning, we have the state-of-the-art this thing. We have all facilities like an OT, speech. We have a speech lab. Please don't misunderstand me. My daughter-in-law is a speech therapist and audiologist, now finished her PhD in Australia, stuck there, waiting to come back. Likewise, my daughter is a food scientist. So as doctor rightly said, on food habits. So I have told her she's working on that. She's also a PhD in food science. So she's working on a diet, what we can do, especially for autism children. And children are totally affected by, as rightly said by Mr. Sir, director from NIPMET, that is mild, moderate, and severe. Okay, so these severe children require a real kind of a diet for them to keep them healthy. And I have personally myself seen in various places. I have visited UK, United States, Germany, and all these places. Except for UK, they have the data collected for autism. There are about 700,000 both children, adults both boys and girls. The ratio, you all must be knowing, it is 1:4 and prevalently more in the boys than the girls. The carrier, they say it's girl, but then the research is on this subject. So I am no authority to speak on that subject, on medical this thing. So these are all the things which we at Anjuman, we have now started a sort of a small clinical this thing to cater to parents like this who are not able, see, that child is not be able to go to a this thing center to do OT or anything. We have started a center which will be between 4 and 7 o'clock. We run this as we don't call it as a school, we call it a center. We are running it as a school, like the school timings, like between 9 o'clock and 3 o'clock. So the children do not feel that they are not going, see, when they see their peers going to school and coming back, instead of going to some center for 1 hour, 2 hours and coming back, we have a full-fledged school. I invite all of you to come and see the facility. And being a charitable organization, we will stand by you. That's my word to all of you here. Thank you very much for the opportunity. Thank you very much. Anyway, all these papers today have come with this of waste for me. Thank you one and all, especially the special mothers.
Thank you so much, sir, for your encouraging words. Our next guest of honor, Ms. Raghavi Senthil Kumar, is a social entrepreneur, a HR consultant, a trainee, public motivational speaker, and most importantly, a warrior mom of 2 kids. She has won more than 25 prestigious awards from her employment and entrepreneur forte. She is also the director of the Headway Academy and the founder of the Headway Foundation. So now I would like her to come up on the stage to share a few words.
A very good evening, one and all. Good evening. Never in my life I thought I'll hold a mic in a hospital like this, because I was all on the, inside the rooms, on the beds and all that most of the time. I started hating hospitals at one point in time. So I never thought I would do this. I think I'll have to wholeheartedly thank Dr. Maria for this. And thank you, sir. Thank you, ma'am, for having me here on this beautiful occasion. Yeah. So I'll come to the word called autism. We've been talking about the Autism Day and all that. With my cutie story, if we have some time. I am a polio victim, got acquired by this polio virus, poliomyelitis, at my 3 months of age. I was born in Hyderabad, and my native is here in Kelambakam. That is my native. That is IT hub today. It was a typical rural village at one point in time. Yeah. So, lack of awareness. We talk about awareness. We talk about coronavirus today. Every kith and kin and every kid is talking about coronavirus. They write essays today, but at that point in that time, we don't know what is polio virus at all. Huh? So what do? A girl child acquired polio, and my parents were at a shock. Of course, the surrounding, how do they see the girl baby and all that? You can really imagine. My mother was, very, very confident that she'll have to raise. I think that's the motherly thing. I could see so much. It is not about, father is not doing good, mother is doing well, nothing doing. Father is equally, they're also special fathers. Fathers are all also equally confident and massive by heart, but they don't express. That is the only thing. Mothers take the first step. That's all. And I could see so many special mothers here, including Dr. Maria. And my mother was strong enough that she said, I'll raise this girl. She did. And she joined the same school where she put in, as a Hindi teacher, because Hindi was very much wanted here, and she was MA Hindi, and she was there till my 12th standard of my schooling. She was all there. Any emergency, she was there. And I did my schooling because my parents, my father had only one thing: education is the only weapon that can take any child, not just me, to greater heights. So on that note, I finished my schooling, and to make my journey a little precise, with a lot of here and there struggles and challenges. Of course, exclusion. Yeah, we're talking. I mean, Dr. Maria wanted to talk to you about inclusion. So inclusion came up, to the society only after we had a lot of exclusions here and there. Yeah. So with a lot of such struggles and challenges and all that, I had my engineering. We were all talking, all people giving us feedbacks, and there'll always be 4 people who keep on giving us feedbacks. Yeah, oh, how can you do this? How can you do that? And all that. But because engineering was a little, too much for me, lathe and workshop and all that. So people were thinking, how can I do that? Because I was wearing my calipers and crutches and all that. And I did my engineering. I did my MBA. I did my diploma in training and development. I'm about to pursue my doctorate now. So education was another thing that we thought it could take us to heights. And I request everybody here to have that in education. And we talk about inclusive education now. Yes, inclusive education. Let us not talk about inclusive education. Education is education, right? Why is it inclusive and exclusive? So education, I think that is one thing that we all will have to make it equal. And employment, that's another phase. How many organizations, how many industries are really looking forward to have differently able people on board? I could see Priya's face here. This is employment, this is entrepreneurship, this is inclusion. Oxymed has included a consultant doing all this, right? So let us all inculcate the habit of entrepreneurship equally, because all these mementos, gifts, and so many things we all do, and there are talented persons with disabilities who are still doing. We're talking about fine motor skills and all that. How many people are really, creative enough to bring a lot of products to this market? We don't know. They are hidden. So let us start give equal opportunity to people, and that is inclusion. Number 3, let us talk about how the society takes us. That is another another step that we really look forward. I used to refrain talking to people, going for functions, no proper ramps, no lifts. There are a lot of logistical barriers and challenges in the society. Disability varies from person to person. We all know there are 21 types of disabilities. Autism is one, locomotor disability is one, and all that. It varies from person to person and case to case. But challenge is one, struggle is one. Let us all be empathetic to challenge. That is what we want. Yeah, and I got married to my childhood friend. I have 2 of my boys here who have come today also, and today I want them to look at what the society is at, yeah, and say, oh, come on, let us be equal. Let us all be, together, because love is the only one thing that keeps us all going. And that is the reason I've brought them today to see this function. And lastly, I am an HR consultant, I'm a trainer, I'm a mentor, I'm a coach. I speak in a lot of forums. I'm a public and motivational speaker. I'm a Government of India empanelment certified POSH consultant, certified POXO trainer, Associate State President of CIMSME. I'm a member of Wiki. I'm also the management committee member of Indian Society for Training and Development today. So this is my profile of what I am today, and this journey has never been bed of roses at all. Yes, we do have, and how we take it up is what is important. And we all can join hands together and keep moving, and that is the only thing I want, to say, because, I run my social organization also called the Headway Foundation, which works for the empowerment of persons with disabilities. All types of disabilities, yeah. Again, there is no distinction between disabilities. We are focused on all the types of disabilities. And one thing that the push that I had when I started this was breaking the stereotype. Rest comes next. We wanted to break this myth. We want to break this stereotype. Yeah? Because people see at the appearance rather than they see what are you. The label is what disability is. What is the label that you carry, and that is how they perceive. So we want to break that myth first of all. So let's break the stereotype today, this moment, and say this is kind of a celebration. Yeah, I couldn't see anything of creating an awareness. Do you all? No, Oxymed has taken so much pains today, and it's more of a celebration. So from today we will take one step higher. Let us not talk about awareness. Let us start celebrating. Let's start celebrating autism. Let's start celebrating disability. Let's start celebrating inclusion. Thank you so much for inviting me. Thank you.
Thank you so much, ma'am, for sharing your encouraging journey with us. I now take the pleasure of introducing our guest of honor, Dr. Mohammed, who's a neurologist at Oxymed Hospital, HOD at Department of Neurosurgery at King Abdul Aziz Hospital in Mecca. I request you to share a few words with us.
Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh. It's my pleasure to appear in front of you to give a small talk about the medical field concerning autism. Everybody came and talked their own experience with their own family members or relatives or in the society, and they confirmed their responsibilities done well. Anyhow, I am going to give a medical aspect. The word autism means a developmental disability significantly affecting the verbal and non-verbal communication and social interactions and learning abilities. These are all affected actually if you analyze thoroughly. So, social interaction and communication, restricted or repetitive pattern of thought and behavior. It is a spectrum disorder, impacts the nervous system and affect the overall cognitive, emotional, social and physical health and learning skills. Okay. Initially, it was categorized into three. First, autistic disorder, sometimes called the classic autism. The second type is the very mild one. The symptoms are very mild in this Asperger syndrome. The third one is pervasive developmental disorder. Anyhow, in 2013, the American Association of Psychiatrists, they devised classifications. The DSM, that means Diagnostic and Statistical Manual Mental Disorder, and it is called DSM-5. DSM-5, 5 categories they have created. First category is with or without accompanying intellectual impairment. The second one, with or without accompanying language impairment. The third one I am mostly concerned with, not the third one. The third one is associated with known medical and genetical or environmental disorders. The fourth one is associated with other neurological, developmental and mental or behavioral disorder. The final category is with catatonia. Catatonia is an abnormal movement disorder associated with autism. Okay. Now, as a neurologist or neurosurgeon, I have seen a number of cases of developmental disorders. I have seen about, in my almost about 30 years of neurosurgery practice, I have seen about more than 700 babies, newborn babies. They were all with developmental brain abnormalities. And they required surgical intervention or medical management. The final outcome was somehow with some type of disabilities. It may be a neurological disability, motor function disability, speech problem, or behavioral problem. Ultimately, we used to refer to psychiatrist. He used to categorize it. Accordingly, they used to manage. So, as a neurosurgeon here, the associated problems such as fits, behavioral problem, and motor function abnormalities, intracranial pressure, these problems can be treated wherever I am present. And if we, Dr. Ayaz Akbar used to display here, we give the treatment, ultimately it is God who cures. It is well explained one. And I am very much impressed to see the parents, establishments, institutions which are confidentially treating such people. The reward is from God because God says, do you think I will not test you? I give you wealth, boys and girls, and status, and your position in the society. Do you think it is all blessings from me? This is a test for you. God says in his revelations, this is a test for you. Your final abode is according to your performance in these things. And I am seeing many people here who have succeeded this test given by God. Thank you very much.
Thank you so much, sir, for sharing your experience with us. I'm extremely delighted to introduce our chief guest, Ms. Vandana Agarwal. She is the director of VVA and VVT group of companies who own two of the five-star hotels, namely Radisson Blu, Chennai City Center, and the Park Plaza at Chennai OMR. She is also the managing partner of Asta Properties Chennai. Ms. Agarwal is also the chairperson of Punjab's Women's Association. We extend our warmest welcome to you, ma'am. I invite you on this chair to share your heartfelt journey with us.
Good evening, all. So when I was invited, I didn't know much about autism, frankly. So, and I also asked the question, why me? So I'm just a businesswoman. I know nothing about this, but I'm happy that I was invited here. Thank you, Saira and Dr. Ayaz Akbar for inviting me, because this has made me go through a lot of, as you said, Google. Google is one person who gives you a lot of knowledge. So I was going through to just know what is autism. So I should say this made me aware of autism, like the awareness you're trying to teach people. So I also became aware by you calling me over here. So thank you for that. So I'm not going to go through whatever I've made notes to say over here, because already so much has been told about autism. Yes, about education, I do agree that every education is not a privilege. Everybody has a right to education. So we need to educate everybody. And then there are some government dignitaries also over here, which I would say we need to open doors to special children like this. Because I think even I was dyslexic, which I didn't know for a long time, that I was dyslexic. I was out in the class, enjoying myself, not in the class. I was most of the time. And the same thing was with my daughter. And later on, when I did say, she's not doing anything in school, what is happening? They said, no, your child is this, and we would not tell the parents because the parents don't accept. So I think parents should start accepting, first noticing the child has some learning disability, notice that, and and for the first time, I think you'll be a little confused. You don't know how to go about it. So it's very important to take some medical intervention, which helps you, which guides you. But later on, it's your own, because you're watching the child 24/7. So you need to guide your child the way she can. So what I did was I changed her from a normal matriculation school into an international school where writing was not required. She was not good with her motor skills. So I changed her that, and she did excellent. She went to London to study, where the education system is totally different. It's not from the textbooks. So she did wonderful for us, and she has joined our business now. So that is all I will have to say, because the rest of it, most of the Wonder Moms here have told everything. So I would not go on to my Google knowledge to tell you what to do and how to do. So in fact, it was a learning for me. But one thing I would like to say is awareness is not just about disability. I think you need to donate to the cause. So I think we need, by donation, I mean identify organization, network, groups that support autism and donate, thus empowering the caregivers and with resources they so desperately need to run those institutes. Have fundraisers, seminars, and conferences, spreading awareness about ability and not disability. We need to lend support and show support. Real life stories like parents and children with autism can inspire and guide all of us. Lastly, I would like to say that every autism kid is unique in his or own way. There should be focus on their ability. The attitude of the society has to change by understanding, acknowledging, and appreciating people with autism and accepting them. Autism is seeing the world from a different angle. They do miss what others catch and catch what others miss. So I would just finish with this. Thank you so much.
Thank you so much for your insightful comments, ma'am. Now I'd like to call upon Saira Parveen, the director of Oxymed Hospital and the founder of Oxymed Foundation. I would like to call her upon the stage to share a few words with us.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome everybody. I think it's been a long meeting. Everybody's been here right from 2:45, and we are already running at 5:15. Just to cut it short, we wanted to put everything in a nutshell. So we've decided that we will have a newsletter, an Oxymed newsletter, which will keep us connected always, inshallah. So all the activities and whatever work we are planning and what are the suggestions from everybody, we will collect and we will circulate so that we'll always keep in touch. So this is our first newsletter here, and we have invited stories, and we have got a lot of response, right from Sholapur, Mumbai, Ahmedabad, Chennai, Coimbatore. A lot of people have responded to our call, and they have all shared their stories, for which we will be publishing. We'll be sending a virtual newsletter. We are already also on the process of launching the Oxymed app, which will be more easy for us to connect with each other. So I think with that, it's good enough. And thank you all for being here. And we've really enjoyed it today, especially the decorations. Thank you. Yeah.
I would just like to add one thing. I think we should have an Insta page or something where all these moms can participate, and parents who have a doubt, they can just write that these are the doubts, how do I deal with it? So it can be answered. So I think there should be an Insta page where all of us can approach and say, this is the problem today I face with my child. So when we say that, I think it works better, because then the parent doesn't have to come and speak. It can be on the Insta.
Just a word, since you said this. To all of you, we are launching from Anjuman a site, a website where the whole thing is given, what we can do, and we also encourage parents with various disabilities of like dyslexia, ADHD, whatever it is, autism. And we will answer their queries. And I said, we are starting off with a clinical side of it from the 4th of, from the month of June onwards, from 4 to 7 p.m.
Yes.
Anybody can contact us at whatever time. This is launched, this website will be launched on the 9th of April. From Anjuman it will be launched. I'll share this thing with Sarah. She's also going to be part of it. So we will share the website with all of you also. Thank you very much. Anytime we are there for help. And Anjuman as a charitable organization, we are open, our arms are open to welcome you all. Any child, for that matter of fact, with any disability or things like that. Thank you very much. And by the way, I have taken up this act. There is an act of 2016, an act which came out for disability, that is physical disability, and the learning disability also has been added. And I had attended a webinar when I was stuck in the US for 1 year. I've just come back in the month of Jan. So there the Netaji Subhash Chandra Bose University in West Bengal conducted this, and they have got all the rights for, working with the central government, they have got the funds. It's very unfortunate in Tamil Nadu government. I have worked with the disability commissioner here, but then he says, we have not got orders from the state government, the center has not this thing. Well, now sir has told me that he will help me out in this thing, because I want to form a sort of an association to be, to link all these people, all the children with autism or anything. It is really, children with autism are never brought out. Like, I'm really proud of these mothers. My hat's off to you all. Because the children has to be brought out. This is what I say even in our, this thing, in Anjuman while admission. I said, both father and mother should be here. If not, I'm sorry. If you can give your time for this child, then I am there with you.
In connection with what Madam said, yes, today social media is one platform where we all can connect with each other and do wonders. Same way, our organization, the Headway Foundation, we support all talents. Yeah, we support right from education, employment, entrepreneurship, sports, talented people, artistic talented people, in fact, people like Ms. Priya, and supporting livelihood. We do a lot of initiatives. So we all can stay connected, maybe with people like Madam Sir and Madam. We all can stay connected by the social media, and we can all help each other, know each other, and try to influence more people positively. Yeah. Yes, I think we all can join hands that way.
I think now we have got to give the mic to Maria, because it's all about her, all about the day with Maria.
Actually, I don't want to, because the day is almost coming to an end, and you'll have seen what a wonderful evening it was. And as Raghavi was saying, it is not about awareness or creation of awareness about autism or any other disability. It is celebrating life. This is what I wanted to say. And I really have to thank Dr. Ayaz Akbar and especially Madam Ayaz Akbar for this wonderful day and the extension of the hand. And as they rightly said, we are here to listen to the hearts. We have listened to you all. And we don't want to just finish the day by, coming here and going back. I want to emphasize, let's get together. Form something. so that we will have a sustainable program going on. Not just a day of awareness, not just a day of celebration, but please walk along with us. And at Oxymed, I think ma'am has great plans, and Dr. Ayaz Akbar also, and there's a wonderful team. And today, what they have put up is extensively beautiful, wonderful, terrific, right? So give them a big applause. Just she asked me, what shall we do for Autism Day? And I just told them, let's hear to the stories. And everyone was saying, Mada Pida Guru Devam Kadayadipo, Mada Pida Google Devam. So everyone, all the parents knows everything. So why should we keep on talking about it? Let us plan together because we need your support. So let this day be where not only the newsletter, ma'am, we will form a team. And as madam rightly pointed out, questions can be answered. We are all here for you all. So please, we need you all. Thank you so much. And I must say a special thanks on behalf of Priya and my husband that Raghavi rightly pointed out, inclusion has happened. And I'm grateful to madam because she is the first person who said, come and display Priya's things, and she is doing it. And she invited us for a health camp, and there we had a wonderful awareness. It is not about selling the goods. It's about saying, we are here in your midst. Look at us. Look upon us. We need your support. So Priya, thank you, and my husband who has been a pillar to all of us. And as sir was saying, the fathers are here, sir. My husband is here, Mr. Anand is here, and there are so many wonderful, and Mr. Sankar Narayanan sir is here. I invited a few fathers because I know the wonderful, wonderful support they are giving, because without them, the mothers, we cannot do anything. My husband supported me so much in studying, in taking care of Priya, and today also we have him to help us in our way of life. Thank you so much. So please leave your name and we will form a team.
Definitely. I think we've got one small sachets to be given to the super moms and super daughters, super dads over here. I think it doesn't, quickly we will finish it.
I would like to invite Mr. Sankar Narayanan, who is a super dad and who had come all the way accepting your invitation as a professional, as a government representative. Thank you, sir. Sir.
நாங்கள் வந்து நிறைய சிஆர்இ ப்ரோக்ராம்னு பண்ணுறோம், கண்டினியூஸ் ரிஹாபிலிட்டேஷன் எஜுகேஷன். சார் பர்டிகுலர்லி அவர் பேர் என்ன? ஸோ அந்த அந்த ப்ரோக்ராம் வந்து தயவு செய்து எல்லா புகழும் இறைவனுக்கு.
Next, I would like to call upon Divya and Anandi. Please come here. வாங்க, உங்க பிள்ளைங்களோட வாங்க. You're not given the memento, huh? அவங்களுக்கு memento கொடுக்கலையா சார்? கொடுத்துருவோம். Divya and Anandi, வாங்க. Give her a big applause. She needs all your support and strength. Super son. Super son. Give him a big hand, please. Nalla karangla tattuvamma. கொஞ்சம் முன்னாடி இப்படி வாங்கம்மா, இப்படி வந்துடு மேம், இப்படி வாங்க சென்டருக்கு வாங்க. நெக்ஸ்ட் Anandi. Give her a big applause, please. Super son. Super son. Rishikesh. Right? Correct? Huh? And next, I invite Jayanti and her husband Anand, and of course Arya. Come, Mr. Anand. Come. Jayanti, Arya, please come.
Hey, hi.
Hi, Arya.
Hi. Hi. Hello, Sana.
Hello.
Hello. You happy?
Yeah, happy.
This is for you.
Yes, Mama. பாடு சூப்பர் ஸ்டார் ஆரியாக்கு ஆரியா இப்படி நிற்கிறீங்களா முன்னாடி நில்லுங்க இப்படி தேங்க்யூ
Next, Miss Next for her. Come. Yes, for her and she. You want to sing? I'll give you. Come. Go sit. I'll give you.
Thank you so much. Priya
And your
Raj.
Mr. Raj and Priya, please.
Please visit the stall behind. Priya is sitting there with all her beautiful artwork. Just have a visit there. Thank you.
Oh, Sana, beta, come. Dr. Maria had come, so.
Priya, again?
They won't let her out.
I will not. Priya become little fat, huh? Good, good. Fantastic. Someone, not yours? She's a son? Oh, I thought you were not married.
My wife's Tasmia. She's a general surgeon.
My elder son is an architect. He was here. He was the one who done the whole hospital.
Just a small, how can we forget Dr. Ayaz Akbar and Madam who is behind the great show. So I invite Priya to come and give them a small token of love and appreciation for bringing all of us together. It's a handwork. So, Priya. And also one for ma'am. For ma'am. Priya, ma'am, kudu. And the book, madam. Thank you so much, ma'am. So,
This is called Blue Lagoon water.
Yeah, Blue Lagoon. Okay.
Yes.
Autism color today. So, celebrating life.
Vote of thanks.
Now I would like to invite Nusrat Jahan to present the vote of thanks.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Good. Assalamu alaikum and good evening. ऑक्सीमेड हॉस्पिटल एक नॉन प्रॉफिट ऑर्गेनाइजेशन है. इस हॉस्पिटल का विज़न है कि लोगों में ये सफ़ात नुमाया करें कि लोग जहाँ भी रहें काम और सेहत के मुताबिक उनकी ज़िंदगी का इंतखाब कर सकें. हमारा अज़्म है कि हम सेहत और सेहत की बेहतरी के लिए पुरअज़्म रहें. सेहत की देखभाल जिस हद तक के लिए आसानी हो सकती है वो करें. जैसे कि नॉन इन्वेसिव ट्रीटमेंट यहाँ पर किया जाता है और हसास माहौल पैदा किया जाता है जो लोगों को सेल्फ डिपेंडेंट बनाता है और खुसूसी माली इमदाद यहाँ से की जाती है. इस फाउंडेशन के आगाज़ के सालों के दौरान अनगिनत सरगर्मियाँ की जा चुकी हैं. हमारा फाउंडेशन का मकसद है लोगों में अवेयरनेस पैदा करना, जिसके लिए हम हेल्थ कैंप्स करते हैं, ब्लड डोनेशन कैंप्स और इसी तरह से बहुत से एक्टिविटीज़ किए जाते हैं. 2021 जनवरी में हमारा पहला प्रोग्राम हुआ था. कोविड की अवेयरनेस का प्रोग्राम हुआ था. आलमी कैंसर डे पर यह प्रोग्राम 4 फरवरी को भी हुआ था, जिसमें तालीम दी गई थी कि सेल्फ एग्जामिनेशन ब्रेस्ट किस तरह किया जाता है. फ्री कैंप्स चलाए जाते हैं. ये चेन्नई के कीलपाक में चलाया गया. वानियमबाड़ी और विशारम में भी फ्री कैंप्स चलाए गए, जिसमें 6 मिनट वॉक टेस्ट किया गया. डायबिटीज़ और ब्लड प्रेशर वगैरह को मुफ्त जांच कराई गई. इस हेल्थ कैंप में बहुत से लोग शामिल हुए और बहुत लोगों ने बहुत सारे फ़ायदे उठाए. इस ऑक्सीमेड फाउंडेशन का मकसद ही यही है कि वो अपनी खिदमात को हर मुमकिन हद तक बढ़ाए. हेल्थ के बारे में आजकल लोगों को अवेयरनेस नहीं होती है. इस तरह ख़ासकर जब ख़वातीन को पूछा गया कि आपने कभी अपना मास्टर हेल्थ चेक कराया है, तो उनका जवाब था इसके बारे में हम नहीं जानते. तो हम लोगों की सेहतमंद इस तरह हम लोगों में सेहतमंद खाने के पकाने का एक कंपटीशन इनेकाद किया गया, जिसमें ख़ासकर ख़वातीन ने पार्टिसिपेट किया. इतना हैरत अंगेज़ खाना तैयार करके लाई थी कि तमाम उम्र के मुख्तलिफ लोगों और सेहत के मुताबिक तरतीब के तहत उन्होंने इसको बनाया था. इसे अगर आप देखना चाहें तो थ्रू व्हाट्सएप जाकर दे सकते हैं. तो आज का ये हमारा जो इवेंट है, इस इवेंट का हम हिस्सा नहीं हैं, मगर इस वर्ल्ड में जो ऐसे वालदैन हैं जो वालदैन ऐसे हैं इस वर्ल्ड के कि जो हमें सुनाना चाहते हैं. और ये जो आज हमने इन वालदैन की आवाज़ हमने जो सुनी है, ये ऑक्सीमेड की गोया के ये आवाज़ उनके दिल तक गई हो. सैकड़ों ऐसे लोग हैं जो चाहते हैं कि हम उनकी बात सुने, ना कि सिर्फ सुने बल्कि उनके साथ हमदर्दी का सलूक करें और उनके साथ हाथ से हाथ मिलाकर उनका साथ दें. ये सारे प्रोग्राम सिर्फ इस वजह से मुमकिन हो सके हैं कि हमारे पास ऐसे हौसला अफाज कोऑपरेटिव टीम, पुरअज़्म डॉक्टर्स और ऐसे नर्सेस और अमली टीम है, जिसकी वजह से आज तक हम ये सक्सेस कर पाए हैं. आज के शाम हमारे साथ रहने के लिए ऑक्सीमेड हॉस्पिटल की तरफ से मैं तहे दिल से आप सबका शुक्रिया अदा करती हूँ. शुक्रिया मंसूरा.
Sir, we can